Hello, my name is Trey St. John. This is my presentation for Internet Addictions with Professor Grant at Indian River State College. Today, my topic will be cybersex addiction and compulsivity. So, what is cybersex addiction? Now, it is not a formally recognized diagnosis by the American Association of Sex Educators, Counselors, and Therapists, or by the DSM-5. So, when we think of cybersex addiction, we're not thinking of a formal diagnosis. We're thinking of a very broad speaking idea of what we would consider to be addiction to online sexual content. And content like that could include a variety of things. It could include things like pornography, what we typically think of as online sexual content with videos. It could also include erotic literature, not necessarily video, sexual images, and adult chat rooms where adults and people online go and they discuss adult topics. And the defining factor in it is that it is compulsive, meaning there is this urge that the client has to engage with the activity, even when it is showing itself to be harmful for them. They show this feeling of irritation or discomfort when they aren't engaging with the activity, and a sense of relief when they do, even if it starts to prove harmful to them. And we'll go deeper into that later on in the presentation. But first, let's discuss some positives of online sexual content because I firmly believe it is very important that when topics of sexuality are brought up in a mental health profession, it is important that we ultimately take a sex neutral stance. Sex is neither positive nor negative without the context surrounding it. So there are two perspectives on it. There is the sex positive perspective where sex is a good, healthy, and natural thing, which I believe is the uh, perhaps the better, more helpful perspective on it. And then there is the sex negative view, where sex is this bad, dirty, wrong, and sinful thing. And this usually comes with feelings of shame for the client. And so I believe as mental health professionals, it is important for us to take a sex neutral stance until the client tells us the context surrounding their relationship with sex. So let's go over some positive aspects of online sexual content. The first and probably the big one is it's recreational. Most people, around 80% of people who engage with online sexual content, they do so recreationally, meaning they do it just because it's fun. They just enjoy it. And most of these people, like I said, 80% do not report issues of things like strain on their relationships, strain in the workplace, feelings of distress. They are able to just engage with sexual content casually and healthily. Other reasons might be for educational purposes. Not all sex content is on the internet is strictly for titillation. Some of it is just educational for teaching on things like safe sex and healthy sexuality. There is a slide dedicated to this, but I do want to talk about how more and more young people are using the internet for sex education, especially as there are still a lot of areas in our education system that don't provide a comprehensive education for sex for young people. And so with the internet, they're finding it there. Now, that is a double-edged sword, and we'll go into that more later, but it is still a resource for people to gain education and knowledge that they otherwise might not have access to. So sexual content online is not necessarily a bad thing. So when is it a problem? Okay, so first off, is the client themselves in distress? Are they telling you that, hey, I think there's a problem here, something is wrong, I'm not having a healthy relationship with this? Most DSM-5 standards would set a period of around 6 months of distress to for a diagnosis on a clinical level. But like I said, addiction itself is not recognized as a formal diagnosis, but that is still a good meter to tell, like, hey, does intervention or assistance need to be provided to the client? Other problems might be like, even if the client themselves doesn't necessarily feel distress about their situation, are they seeing to their responsibilities? Are they maintaining healthy relationships with their families? Are they doing what they need to do for their job? Are they eating? Are they maintaining healthy hygiene? Are they just seeing to everything that we would normally associate or typically affiliate with a functioning human being? because not all people who struggle with a cybersex addiction believe that they have a problem. Sometimes it is an outside source saying, hey, the person isn't seeing to the responsibilities these they need, and we can see that this is having a problem on them. So if there is an impairment of function, that is another thing to consider. So there are some questionnaires that can be used to further ascertain if there is a problem. The first one is the Internet Sex Screening Test. This is a simple questionnaire where you just ask the client a series of questions and they say whether they agree with the statement or not. And depending on the level that they are at, then there may be more reason to believe that there's a problem. Like if they get a low score, then chances are like, hey, they probably don't have a serious problem. A higher, medium score, it's like, yeah, there's a bit of a problem, and we can do some things to adjust and help. Higher levels, like, okay, there might be some more of an issue that we should address. Another assessment is the IAQ, which is the Internet Assessment Quick Screen. And again, it's very similar in structure, where you ask the client a series of questions and they answer back how much they agree or disagree with the statement. Lastly, is the client engaging with illegal activities online? Now, most of the time when this regards cybersex, this is about the engagement with or distribution of child pornography. And this is a very serious topic. When the client presents these issues, or the clinician suspects that these issues may be a thing, it is important to have, without exception, a comprehensive sex offender evaluation. So by a qualified clinician to determine, is the client a threat to young people. Now, not all people who engage with that type of content themselves are attracted to minors, but it is definitely something that needs to be addressed if it presents itself as a problem. Now, let's discuss young people in the internet, because young people have a very special circumstances when it comes to the how they engage with sexual content online. For starters, most young people, they are uneducated. They don't know about sexual content, in large part because so many parents and teachers are afraid to really comprehensively discuss it with them. And so, but these young people still have these questions, they still have these feelings, and they have access to the internet pretty much everywhere they go nowadays. So they go online to try to answer these questions for themselves. And that leaves them open to exploitation. And that goes back into what we were talking about earlier, where they are at risk of, like, they could go to these adult chat rooms that we mentioned earlier, where they could speak with someone online who probably doesn't have their best intent, have their best interests at heart, and be taken advantage of. They may also develop their own compulsive behaviors in regards to sexual content online. Young people are just as open to developing these compulsive behaviors as adults are. And depending on how they engage with this content, they could start to develop their own compulsive behaviors. Now, when we are looking at young people for these issues, it is important to have open discussions and assessment with them. Young people are a lot smarter than we give them credit for. They should be treated with the openness and respect that we would give any other client. We need to develop that trusting relationship with them so that they feel comfortable coming to us and talking about these. A lot of this does come down to education. Only 38 states have mandatory sex ed classes. Originally, this image that you see here on my screen, that originally only said 13 states require sex ed that is medically accurate. That has since been updated to 18. So I had to do a little professional editing here, but still only 18 mandate that sexual education be medically accurate. And so there is a definite lack of comprehensive sex education in our school systems for young people right now. And I understand it can be uncomfortable having these discussions with young people. We have a lot of what I call squick about the sexual content, that uncomfortable feeling about being open and honest with what sex is like for in the real world. Even among adults, we still get that sense of squick. I'm having a little bit of it right now, just giving this presentation, but that's why I believe it's so important for us to discuss it, because it is a big deal and it is something that is potentially either very harmful or very healthy, depending on how you engage with it. And so when we're talking about and working with minors and young people about their engagement with sexual content online, we need to monitor them. It's not about, I'm trying to pick my words here carefully, because it's not about constantly like peeking over their shoulders and watching every little thing they do. They still need to feel trusted with them. There still needs to be an open dialogue. They need to feel comfortable and safe letting us know, like speaking with the adults and the teachers and the instructors in their life about this stuff, so that they can be safe. So when I say monitoring, it's not about gazing over their shoulders. It's not about, like going, what are you doing? It's about establishing communication and trust with those young people. So let's move on to how can we manage cybersex addiction. Now, there are a few techniques, and these techniques are viable for both adults and the young people we discussed earlier. First things first is computer management. Set times and days. And so what this is you set specific times and days where you will use your computer. So say a client, not I, but a client will say, okay, so I will take I will allow myself access to the computer from 9 in the morning to 5 o'clock in the afternoon because I need to use it for work. And then I will have that be from Monday through Friday, and afterwards I don't use my computer. I don't use it at all. Or at the very least, that is a set rule for them. There's also installing monitoring softwares. There are programs and filters and blockers that will see and make a data sheet of how you're actually spending your time online. And so if you see like, hey, I spent a good portion of my time doing research and doing my work and all this, but then I see like, oh, I spent so much of this time on adult sites, then it provides data that clients can use to make adjustments to their behaviors. And the filters and blockers are very simple. They just block access to that content altogether. So if a client is really struggling to just refuse it to just abstain from engaging with sexual content, they can install programs that block their access to it. Environment management. Now, these are techniques that involve less of the computer itself and more of where you are when using the computers, like using it in high traffic areas with other people nearby, because you might be less likely to engage with that kind of content when, say, you're at a big restaurant and you're surrounded by a whole bunch of people, or you're in a public area where anyone might be able to stumble across and see that content. It's a sort of social control in that sense. Specify where the computer can't be used. Like you say, okay, so I am, say the client, okay, again, I keep using myself as an example. I should say a client will set a rule for them. Okay, I will not use my computer when I am visiting my child's school. I will not use my smartphone while I'm at my child's school. I will not use it when I am having dinner with my family. I will not use it here, there, these are all like certain rules that the client sets for themselves to manage how they go about engaging with the technology in their lives. Lastly is an acceptable use policy. Now, this is a bit more of a open policy, like where the client said, okay, so when can I engage with this content? When am I open to engage with this content? And it's another set rule. It's a boundary that the client sets for themselves to manage how they go about engaging with the technology around them. Alrighty, and here are a list of my sources. I do hope you enjoyed this presentation, and I hope Hope that you all have a fantastic day.